Hi May, how are you today?
I'm doing well, Alice. How are you?
I'm good. For today's treatment, I think I really want to focus on the cheek area,
Okay.
just to demonstrate how to really loosen up the cheek area and make more definition in the cheekbones, especially for things like TMJ pain.
Okay.
And people who suffer from jaw pain and migraines. This treatment is especially good for those type of people.
Okay.
But it's also great for facial rejuvenation.
Okay.
It gives more definition to the cheekbones and more radiance there.
Okay.
So we'll focus on that today. So we're gonna do more deeper work in the cheek area.
Okay.
Last week we did very more superficial work for more lymphatic drainage techniques. But today I want to show more like myofascial release techniques. So that's what we'll be doing.
Okay.
And I'll be using more of the facial cupping.
Okay.
And also my hands.
Okay. That all sounds great.
Okay, I'm gonna get started.
Sure.
I'm gonna take a look at your tongue. Okay, this week looks better. Less phlegmy.
Okay.
So, have you changed your diet this week?
I've cut down a little bit on the dairy, not as frequent.
It's showing, on the tongue.
All right.
Your stress level seems to be about the same.
Okay.
Yeah. So, we'll focus on your stress today.
Sure.
And anything else you want to focus on?
No, I think that's it.
Yeah? Okay.
I'm excited about the jaw work because I find that lately I've been holding more stress in the jaw.
Oh, okay, yes. So a lot of us hold a lot of tension in the masseter muscle, which is runs from the cheek to the chin area, and it's the most powerful muscle in our body.
Really? Huh.
Yeah, so it's like it helps to clench our jaw for mastication, for chewing.
Okay.
So we tend to like clench that area, and then it creates almost like a little bubble in that area.
Oh, okay.
Yeah, so
That's
we
good
can
to
really
know.
focus on that today.
Yeah.
Yeah.
I've been trying to practice on where I keep my tongue in my mouth because I've been following like different functional dentists online, and I've realized that I've just been keeping my tongue in the wrong place.
Where are you supposed to keep your tongue?
On the roof of your mouth.
Yes, that's also in Qigong.
Okay.
We like to keep the tongue on the roof of the mouth because energetically it travels in the Du channel, which is kind of like on your spine area, and then it goes to the top of your head and comes down to the palate, and then the chi is supposed to connect, so the tongue connects the chi down also to the Ren channel, which is front of the body.
Oh, okay.
So it's ideal to keep the tongue on your...
Yeah, I had no idea. I only learned of this recently.
Okay, we're gonna start with an herbal mask again.
Okay.
It's the same one as last week.
Great.
It's a little wet. Let me know if this could be a little too hot.
Okay.
Let me know. Is that all right?
Yes.
Okay. All right. We'll start with some lymphatic drainage.
Okay.
And then we'll do the facial needling. All right. Now we'll do the facial needling.
Okay.
Okay, just take a deep breath. Exhale. All right, today we're gonna focus on more of the cheek area, releasing some of the acupressure points and also some of the insertion and the origin of the muscles on the cheeks, especially focusing on the masseter muscle, which is right here, and it's the most powerful muscle in the body, and we tend to keep a lot of tension in this muscle, and it tends to actually feel bulging on the fingertips. And by focusing on the muscles of the cheeks, we can bring more blood flow into the cheek area, and that would cause more of a rosy complexion. And also it could really smooth out any of the wrinkles and create more radiance in the skin. And it's also very good for people who are suffering from TMJ dysfunction, jaw pain, and migraines and headaches, because the temporalis also connects with the facial, the cheek muscles here. So it's all connected in the cheek and in the temporal region. And right now I'm feeling her cheek area, and I really feel a lot of bulging in the chin where the masseter muscle inserts, and so I'll be needling in this area more carefully. So right now I'm focusing on needling stomach 5 and 6, because that's where the insertion of the masseter muscle is. I'm using a little bit longer needle just to kind of go into more of the muscle fibers with the needles. I'm also going to needle the submandibular area, because this is also where the masseter muscle can be tight. Okay, all the needling is done. We really just focused here on the cheek area, especially the stomach points here, and it happens to be the insertions, the origin, and the insertion of the masseter muscle, which is really what we're focused on here. Happens to get very tight on many people because we tend to really contract the muscle when we are stressed, and it becomes hypertrophic. Right, we're gonna start with some myofascial release. We're gonna focus on the cheek area today. So I'm gonna start here. Let me know if this is too hot.
Okay, it's a little hot.
It's a little hot? Okay.
Okay, that's better.
Better? Okay. Alright. This is a little bit of a deeper stretch because we're doing the myofascial release, so we're really trying to go to the layer of the fascia that wraps around the muscle fibers, the muscle belly. Okay, we created a good suction here, and we want to target the masseter muscle, which runs from the zygomatic arch down to the chin. So you want to gently use your other hand to pull back while you're pulling towards the insertion of the masseter muscle. How does it feel?
Good.
Good? Okay. The patient should feel a sense of release. It's very important to go very slow to really bring in more fluid into between the fascia and the muscle. And right here is the TMJ joint. So it's okay to let the cupping sit for just a minute to really bring in more blood flow into this area and stretch out the fascia in this area. A lot of muscles also attach in this area, so it's nice to just let the cup sit there for a bit. Just gently move around, circular motion. To really stretch out the fascia in this area. And this area tends to be problematic for people who have TMJ pain, jaw pain, also can radiate to the head, causing migraines and headaches. I'm gently gliding the cup along the insertion of the masseter muscle. And here in the zygomatic arch. Alright, let's do the other side. This is a myofascial release technique, not lymphatic drainage. So you want to get a really good suction into the cup, and then thinking about stretching out this subcutaneous membrane that is between the skin, that is wrapping around the muscle layer. Alright. How does your cheeks feel now?
Really good.
Yeah? Okay, more relaxed.
Mm-hmm.
Yeah? Okay. It's nice to also stretch out the yin tongue, the third eye point here.
Yeah, that feels really good.
Yes, it really helps to drain the sinuses. It's a good relaxing point. So if the person is experiencing a migraine, this feels very nice to gently stretch. Alright, so the myofascial release is finished. And now I'm going to finish with some gua sha. And then I'm going very light to promote more the lymph to drain into the lymph nodes after doing some myofascial work. A lot of the residual kind of toxins that gets built up in the fascia gets released, and it's really nice to just gently encourage the fluid to go into the lymph nodes for further processing. And then in terms of gua sha, we can actually use the tool to do some trigger point therapy here, especially in the masseter muscle here. We can do a little bit of scraping to really relax the contracted hypertrophic muscle. Okay, open your jaw for me. Alright, and then you can really massage the TMJ joint here while the patient opens her mouth. Close. And the pterygoid muscle, which helps to open the mouth, also sits right here, and that muscle gets very tight as well as the masseter muscle gets tight. Alright, other side. Open.
can go pretty deep in the TMJ joint. It gets very tight for many people. All right, close. Okay. All right, one last lymphatic drainage. And the temporalis muscle also could get very tight. It helps to clench the jaw with the other muscle, such as masseter muscle. And this area could cause headaches when it gets tight, so it's nice to just gently massage the area. Okay, how do you feel?
Much better than when I came in.
Oh, good. You look more radiant and relaxed.
Thanks.
And yeah, we'll take an after photo.
Okay.
Your chin looks amazing.